Well, hello everyone. This is Dr. Amigues, your friendly rheumatologist, for another live with Dr. Isabelle Amigues, live Rheumatology 101 lives. Today we are talking about what should I do if I have a flare? What can I expect? This is a question from the audience. Again, remember, if you have questions, don't hesitate to put comments. You can also email us to us at social@onabridgemd. We are, let me just make sure that there is, yeah, right there. It's all good for Instagram. So in the next 10 minutes, 10, 15 minutes, we're going to go over what to do if you have a flare. So the first thing is, when do you usually have flares? So flares is if you have a rheumatology condition such as the gout or psoriatic arthritis or ankylosing spondylitis or rheumatoid arthritis, you may develop sometimes a flare. So meaning our goal, as I have mentioned very often, is to get you to full remission, and then you may have flares. So we're going to give examples, and then that way we can share what to do then. So I'm going to give the example of this patient I recently saw, right? In his 40s, and I'm going to use him because he has gout. He had gout, did so well, so well. So this patient had like more than uric acid, more than 10, so very high. And we started him on allopurinol, which is decreased the uric acid, but with it, we started him on colchicine to prevent flares. And did super well, actually reached the goal of the uric acid, so perfect. And then calls me, I remember I was in France at the time, calls me because he had a flare. What had happened is that he had something called tophi. And so it's basically reserve of uric acid that goes under the skin. And those crystals, as it goes, basically need to melt first before you're really in full remission. And so he developed a flare, and it was pretty painful. It was a gout flare. So then what do we do? Well, basically at the point, what you want to do is you want to first, so for him, let's look at him. So for him, what we did is that we looked at his uric acid level, and we looked at what we were doing. So we doubled the dose of colchicine so that it would take care of the flare. That was not enough. So we had to actually give a little bit of prednisone. Okay, not long, really not long, just to go through that hump. And then we start looking at where are we at in the uric acid level, and he was still at goal. Well, then how is it going with his tophi? And is it actually moving, or do we need to do something else than just allopurinol? And in terms of this patient, he's done really, really well. His tophi have all melted, and he's in full remission, and hasn't needed any more doses of prednisone. But if he had another flare, we would have done the same thing, which is like, do you need more colchicine? Is the colchicine enough? Do we need to give a little bit of prednisone? And do we need to do another treatment than just the treatment for the uric acid? Is the treatment of the uric acid enough? In rheumatoid arthritis, it's the same. In psoriatic arthritis, it's the same. What we have to realize here is that when you have a flare, what's the goal of our treatment? The goal of our treatment is to get you to full remission, right? Like full remission, normal life. The only thing that's happening is that you may have a treatment. Okay, so full remission. So that is where we're going. And then along the way, while you're going there, you may have flares. And what's happening very often is that our patients are freaking out because they're like, wait, I was doing so well. Why do I have a flare, right? Because if you take someone that's really severe at first, you get rid of their symptoms, they expect that they're never going to go back. And unfortunately, that is not exactly how it always happens. It can, but sometimes you have humps, and those humps you need to take care of. And the thing that's really important in those humps is to realize that you have to talk to your rheumatologist, because our question is this a flare? Or is this because our treatment is not working? And that is what's really important. Did the treatment work before and now is not working? Or is it that our treatment has not had the time to work? Or is it because I gave you prednisone at one point, or maybe you got steroids while on, for example, Rituxan, you're going to get steroids and the premedication, and then that's not working as like the Rituxan didn't take the, like it hasn't had the time to work. And so that's really what you want to look at is, one, were you perfect and suddenly you have a flare? Can you see if the flare is related to something that you've eaten, to stress level in your life, to changes in hormone changes? Is that what is happening? In that case, we can take care of that. Or is it that the treatment is not working anymore? Or is it that the treatment hasn't yet started to work or hasn't fully worked yet? Okay. And it can be a little bit of a combination of all of it. And so when you're seeing us, what we're looking is, one, how do I help you right away to make you feel better? That's number one. Like that's the most important. Like we don't want you to be in pain. Does an anti-inflammatory is enough? Does an injection of steroid at one place is enough? Okay. Because if you have only one joint that's bothersome, we can just put some steroids in that one joint or two joints. We don't have to deal with the whole, we are not going to give you steroids for all of your symptoms. So for all of your body, if it's only two joints. And then the other thing is, how severe is it? And do you see an improvement from prior? And are we losing the efficacy of your treatment? Or on the other sense, are we actually trying to help with, are we going into the right direction? So some of the things that I would recommend everyone does and to work with their rheumatologist is, first, write, have a journal of your symptoms. You can take your phone and have notes and have a journal. Date, how do you feel? Okay. Where is the pain? In which joint? Do you have and then some of the question that we're always going to ask you is, how intense is the pain? That's important. When is it the worst? Is it in the morning? Is it at the end of the day? Because that tells us a story. And then do you have morning stiffness? How long is the morning stiffness? And then finally, what have you taken to make it better? So you write that when you're having a flare, and then you reach out and you follow that. You reach out to your rheumatologist. Hopefully they can see you in the next couple of days. If they cannot, that's okay. You just tell them what's happening. Like, okay, those are my symptoms. I just want to let you know. If you have joint pain that's worse in the morning, associated with morning stiffness, you have swelling of your joint, it is a flare of your inflammatory arthritis. If the pain you have is at the end of the day, it most likely is related to wear and tear. Maybe you have done too much with your joint because maybe you feel really good and maybe you're using a little bit more your joint than usual. So that's what you want to look at. That's what we are looking at. And then we want to help you with your pain. So number one, was it because you changed your diet and maybe you ate a little bit more processed food? That happens. Don't beat yourself up. It's okay. Maybe your body is just more sensitive. So take care of that. Okay. One. Number two is do you need the medication? So we always say, okay, well, start with NSAID if you can, if you don't have contraindication. So ibuprofen, Advil, Aleve, all of those, right? You can try and see if that can stop the pain. And then if that's not enough, talk to your rheumatologist. There might be some medication like prednisone that we may give you for the shortest amount of time. Again, shortest amount of time to help you. And then finally, if this is a one-time only, you may not need necessarily to see your rheumatologist because maybe you don't necessarily need to change the management. But I would assume, personally, I would tell you that if you have any sort of rheumatologist that's in an insurance-based model, they probably cannot see you very fast. So make the appointment. It's okay. You can always cancel the appointment 2 weeks before, not the day of. Cancel it 2 weeks before just to say, hey, I'm actually doing well. It's okay. We can keep our scheduled appointment. But in general, it takes a long time. If you're in my practice, I can see you the next day or, in 2 days or even the day of. That's fine. But it's a different type of practice. And I understand that not everyone is lucky to have me as their rheumatologist in the sense that it's an investment, right? But yeah, so you want to share with them the flare that you have. And I think the thing that you have to realize is that from a rheumatology standpoint, our question is always, is our treatment working? Do we need to change our treatment? Because prednisone is just not something you want to be on forever, right? And it has to be for short term. I think that's basically it. Again, when I'm thinking of my patients, in general, if they start like one flare, I'd be like, okay, one flare. It was one flare. If you have 2 flares on the treatment I'm giving you, that's not good. That means that my treatment is probably not working. And so the good news in rheumatology is we have a lot of different treatments. All right. Just saying hi to everyone. Hi, Tiff. Hi, Lindsay. Thank you for joining. If you're watching this as a replay, hashtag replay. And then what I wanted to share is that the holidays are coming. I'm going to do probably a little bit of advertising about the fact that we all need to take care and to invest in ourselves. Health is really, really important. You cannot do anything else if you don't have the health. Ask me, I know, right? When your health is at stake, that is the number one thing that you're going to have to deal with, right? Your health. If you're here, if you're watching those videos, that means that you're already someone that really invested in your health. So I appreciate you. I think that that's really, really important, and good job on doing that. Like, I really want to say that it's not everyone. Most of the time, very often, what happens is that we wait until we have a problem to come and watch and learn about what's going on. But I really want to share the fact that you can take care of you first to take care of other people. And also you can take care of other people as well. If you are interested in seeing a rheumatologist, either as a second opinion to make sure that you're doing the right thing, and I've definitely have done that, and our patients are in remission, you can get into the practice, and I'm opening some time in December and in end of November to see more patients. So please don't hesitate. Let's come in and offer yourself and invest in yourself to be in full remission. All right. If you're watching this video, that means until the end, that means that you thought that it was helpful. If it was helpful to you, share it with someone that you think will benefit from this. And until then, I will see you next week. Thank you so much for being here, for listening. Take care. Bye-bye.